Thank you for joining the RTC's Metropolitan Planning Subcommittee. Mr. Chairman, staff is ready for you to begin.
Thank you. Good morning, everybody. Chair Dimitrios Karapanagiotis for the record. I'd like to call to order the March 9, 2021 meeting for the Regional Transportation Commission Metropolitan Planning Subcommittee. RTC staff will begin with a roll call of subcommittee members, introduce staff on the line, and touch on a few housekeeping items. Ms. Lively.
Thank you, Mr. Chairman. Reagan Lively, Management Analyst for the RTC, for the record. I will be calling your name in alphabetical order. Please confirm your attendance as I read your name. Mario Bermudez.
Present.
Alejandra Fazekas.
Present.
Don Johnson.
Present.
Chairman Kapanigitis.
Present.
Johanna Murphy.
Present.
Araceli Pruitt.
Present.
April Raybuck.
Present.
Victor Rodriguez.
Present.
Richard Seacrest.
Present.
Fred Solis.
Present.
And Kimberly Sullivan. Kimberly, you are still muted. All right, we'll check Kimberly a little bit later. Thank you. Also, please note that we have several RTC staff on the line for today's meeting. This includes Mr. Andrew Kelman, Acting Director of Metropolitan Planning Organization, Mr. Daniel Fazekas, Senior Transportation Planner, Mr. Paul Gully, Management Analyst, Ms. Michelle Laramie, General Planner, Mr. Mohammed, Principal Transportation Planner, Ray Lathrop, Manager of Regional Planning, and Lee Su, Senior Transportation Planner. As the chairman mentioned, I have a few housekeeping items to go. Please state your name for the record before speaking. Be sure to mute your line if you are not speaking, but please note that staff will mute your lines and mute callers with background noise. Voting will be done verbally as a for ayes and nays. There are no nays, abstentions, then the motion will carry. If there are nays, the call vote will be required. In the event of a roll vote, please wait for your name to be provide your vote. The chair will call for any questions after an item has been presented. Thank you, Mr. Chairman.
Thank you, Ms. Lively. I will turn it over now to Mr. Kelman.
Thank you, Chairman and members of the subcommittee. Andrew Kelman, Acting Director of the MPO, for the record. The first item on the agenda is to conduct your first citizens participation period. As you all know, on March 22nd, 2020, the State of Nevada Executive Department issued Declaration of Emergency Directive 006, which suspended the requirement to have a physical location for public meetings. Pursuant to Directive 006, and for the health and safety of the community, this meeting is being held telephonically. To allow for public participation, the RTC is accepting public comments via email at publiccomments@rtc.com. Comments can be submitted to be read aloud or to be added directly to the written record. Ms. Reagan Lively, Management Analyst, will read the public comments received by the RTC.
Thank you, Mr. Kelman. Chairman Dimitrios Karapanagiotis for the record. This is the first time set aside for public comment. This time is limited to comments on items included on the agenda. Comments will be limited to the first 500 words, with the remaining words to be included in the written record. Do we have any comments?
Thank you, Mr. Chairman. Reagan Lively for the record. There are no public comments at this time. Mr. Chairman, that concludes the initial public comments item.
Thank you, Ms. Lively. Moving on to Mr. Kelman.
The next item is to approve the consent agenda, which consists of items 2 and 3 and may be taken in one motion.
Thank you, Mr. Kelman. Chairman Dimitrios Karapanagiotis for the record. Are there any comments or questions from the subcommittee? I hear none. Then do we have a motion on the floor?
This is Mario with Clark County. I move for approval.
We have a motion from Mr. Bermudez for approval. All those in favor say aye.
Aye. Aye. Aye.
Aye.
Aye.
Aye.
Any opposed? I hear none. Then the motion carries. Mr. Kelman.
Thank you, Mr. Chair. Again, Andrew Kelman for the record. The next item is to receive a presentation on the Southern Nevada HOPE Grant Study, which is being led by RTC planning staff. Mr. Daniel Fazekas, Senior Transportation Planner, will present this item.
Thank you, Andrew. Daniel Fazekas for the record. This morning, staff will introduce and provide a general overview to the Southern Nevada HOPE Grant Study. HOPE is an acronym for Helping Obtain Prosperity for Everyone. The HOPE grant program is run by the Federal Transportation Administration. And last year, the RTC was awarded. Hello? Thank you. So last year, the RTC was awarded a $125,000 grant from the FTA to study how microtransit could improve access to jobs, healthcare, and other essential services in underserved areas across Southern Nevada. The grant study will review potential microtransit zones that target low-income areas currently underserved by fixed route transit. The study will also address inequalities in access to healthy food, workplaces, and community services, with the goal to improve transportation efficiency and access to essential services for residents who experience high barriers in having their basic needs met. The RTC was one of 25 agencies across the country to receive this grant award. The microtransit study will build upon and implement several recently adopted transportation plans, including the RTP, Access 2050, the Onboard Regional Mobility Plan, and the updated Coordinated Public Transit Human Services Transportation Plan. So this slide here shows the HOPE Grant study area. The study area is primarily within the urbanized area in Southern Nevada, specifically targeting areas that have historically been marginalized with persistent poverty. The map displays opportunity zones in gray, and the red is census tracts with poverty rates of at least 20%, measured through ACS data through census. Low-income residents need to either spend a large portion of their income to maintain their car or do not have a car at all, and therefore are limited in transportation options for daily tasks. Studying and developing a new microtransit service that target low-income communities can ensure essential workers such as nurses or grocery clerks have access to jobs, healthcare, and other critical services. Additionally, microtransit zones may be used for income qualified riders for on-demand trips when fixed route services are not available. Next slide. So just a basic background, what microtransit is. Microtransit is usually tech-enabled multi-passenger transportation services that offers flexible routes or on-demand scheduling. It fits somewhere in between mass transit, public transit, and ride hailing like PNCs like Uber or Lyft. Next slide. The ability to involve local nonprofits and government entities in studying microtransit systems that target disadvantaged communities, underserved communities, and really was essential to obtaining this grant and essential to go forward in the study. I want to mention specifically Helping Hands of Vegas Valley, Southern Nevada Transit Coalition, US Vets, and 3 Square. They were really helpful and essential in the grant application. And going forward, they'll be part of a ever-growing stakeholder group that will provide feedback on throughout the study. Next slide. So study deliverables. There's kind of 4 main buckets that come out of this study. Hopefully, the first.
Daniel, we just lost your audio.
Can you hear me now?
There we go. Now we can hear you. Thank you very much. Daniel, we're still not able to hear you now.
Hello?
Daniel, can you please try
Hello?
that again?
Hello? Hello?
Now we can hear you. Thank you.
I'm sorry. Okay, sorry about that. Did you lose me on this one here on the or previous slide? I can go back if I need to.
No, I believe we lost you at the Hope Study deliverables slide.
Oh, okay. So if there's four main buckets coming from this study. Stakeholder and community engagement is a big portion of this, making sure we're down into the community. We've already targeted those areas, but are there additional areas that are to be looked at? So food deserts. Through the study, we'll find out there's additional areas that we need to address and talk to the community. The three other deliverables are really going to be coming from an overview through the RTC Transit and Paratransit, as well as stakeholder groups. Be sure that this study works for them. So a microtransit feasibility study, looking at potential microtransit zones or routes, different scenarios will come from that. Evaluating existing and planned services. So looking at where needs need to be gap where there's a gap for needs, such as food pantries, pharmacies, medical services, where people are trying to get to. If they're unable to get to those services or to those resources, how do we fill those gaps? And then finally, implementing this. So looking at the transit as well as kind of an inventory of services and gaps in those services. How do we bring all those together? Showing costs and different scenarios on how to actually run it in the future. Next slide. So project timeline, we're currently in the RFP process right now. We anticipate the study to begin sometime this summer. We anticipate the project to take about 12 months and then be complete sometime in the summer of 2022. Next slide. This concludes my presentation, and I will be happy to answer any questions the subcommittee has.
Thank you, Mr. Vizicas. Any member has any questions? Hear none. If there are no more questions or comments, we can move on to the next item. Mr. Kelman.
Thank you, Mr. Chair. Andrew Kelman for the record. The next item on the agenda is item number 5, and this is to review the Regional Transportation Plan Amendment Clark 21-07 to the 2021 to 2050 Regional Transportation Plan. Mr. Mohammed Farhan, Principal Transportation Planner, will present this item.
Thank you, Andrew. For the record, Mohammed Farhan, Principal Transportation Planner. Item 5 is to review and approve the Regional Transportation Plan Amendment, Clark 21-07 to the 2021 to 2050 Regional Transportation Plan. RTP was adopted by the RTC Board on January 14. Please, next slide, please. On January 14th of 2021. Federal regulations require the RTP to be amended when there are major adjustments to the program in the RTP. RTP is a 20+ year document, planning document identifying the transportation vision, strategies, and the funds for its implementation. The primary purpose of this amendment is to incorporate new transportation projects and funding and program changes. RTC, Transit Department, Clark County, and NDOT, the Nevada Department of Transportation, requested this amendment. Next slide, please. As the RTC Transit requested to adjust funding program for the operation and maintenance of paratransit and transit system, as reflected in the changes below. These are the requested changes: reduce funds for the paratransit fleet expansion program from 18.4 million to 15.9 million, increase funds for the RTC paratransit fleet program from 79 million to 86 million, increase funds for the RTC Transit Fleet Buses Program from $353.5 million to $373.8 million. Reduce funds for the RTC Transit Improvement, Repair, and Maintenance Program from $75 million to $71.9 million. Next slide, please. Clark County. Clark County requested to add 10 new projects in the amount of $443 million that are part of the county's continuous Beltway Improvement Project implementation. Other projects the county requested are the Airport Connector Phase 3 and the Tropicana Avenue and University Drive Interchange grade separation project. The list, as the list shows, Airport Connector Phase 3 is about $25.8 million, and Tropicana and University grade separation project is $165 million. And all these Beltway projects, different segments, county is improving, widening these segments from 3 to 4 lanes in each direction. Next slide, please. Again, some of the county projects widening. And the next is the Nevada Department of Transportation requested to add 5 new projects in the amount of $33 million and adjust funds for 2 other projects. These projects are part of the NDOT's rehabilitation, maintenance, and other transportation improvements in Southern Nevada. As you can see, like some program changes on these 2 projects, I-15 North in Logandale, just changing the funding category from state gas tax to the federal program, and increased funds for the I-515 Charleston Boulevard interchange from $50 to $60 million. Next slide, please. Other projects are in some concrete repair on I-15 and Summerlin Parkway rehabilitation project, AD improvements on the US 93, and some landscape and aesthetic improvement on I-11, which is the US 93 I-515, and again the Sahara Avenue rehabilitation project. Next slide, please. So this is the amendment which required a 30-day public comment period which started on March 2nd and ending on March 31st. And this was the amendment as we added some new projects requiring the air quality conformity determination. And the RTC has conducted this air quality determination and determined that there is no negative impact on the air quality as required by the EPA. So this is presented today and will be presented to the ESC on April 29th and for the board's consideration on May 13th. Next slide, please. And this concludes my presentation, and I'll be happy to answer any questions subcommittee has.
Thank you, Mr. Farhan. Any questions from any member?
Mr. Chairman, this is Reagan Lively for the record. I just want to note that Jason Love with the City of Las Vegas is currently on the line and in the meeting.
Okay, thank you, Ms. Lively. Any questions for item number 5? I hear none, so we can move on to the next item, Mr. Kellerman.
Thank you, Mr. Chairman. The next item on the agenda is item number 6, and it is to receive a presentation on the Southern Nevada extreme heat vulnerability research being led by regional planning staff at the RTC. Mr. Paul Gully, management analyst, will present this item.
Can you hear me okay?
Yes, we can hear you now, Paul. Thank you.
Okay, perfect. Sorry. So thank you, Andrew. Paul Gully again for the record. I'm excited to give you all an overview of the extreme heat vulnerability study today and go through some of our preliminary findings. In terms of our timeline, we're approximately 3/4 of the way complete with the study, which I think is the perfect time to bring you all up to speed on what we've done thus far, what's still left to do, and where we could potentially go with a phase 2. Next slide. So here's kind of a high-level synopsis of the scope of the study. Starting with the why, which I don't think is news to anyone here. If you can click to get the first box, perfect. So it's hot here. It's gotten hotter over the past few decades, and it's expected to continue getting hotter. According to a few recent studies, we're the fastest warming region in the country. Since 1970, we've had an average annual temperature increase of more than 5 degrees. And with increasing temperatures comes a bunch of negative impacts, from the stretching out of allergy seasons to added wear and tear on our infrastructure, and of course, prolonged drought that contributes to strain on our water supply. But most importantly, studies have found a clear link between increasing temperatures and increasing heat-related deaths and hospitalizations. So over the 10-year period from 2009 to 2018, there were nearly 600 heat-related deaths in our region, according to health district records, with numbers spiking in the most recent years. And over the 3-year period from 2016 to 2018, there were just as many heat-related emergency room visits, so slightly over 600. And, you know, both public health and medical experts will tell you that these numbers are almost certainly an undercount due to the way that this data is tracked and kind of coded at hospitals. And experts will also tell you that heat-related deaths are largely preventable. But we do need to take the steps to prevent them. If we don't, you know, it's very likely that these numbers will continue to get worse as our temperature increases and as our population continues to grow, especially considering that we're forecast to get much older as a region. And older adults, especially isolated older adults, have been found to be among the most vulnerable to extreme heat. And so thankfully, our region has kind of taken notice, and this is just one of a handful of studies related to extreme heat vulnerability that's currently underway. Each one has a slightly different focus, and with our study, we're specifically aiming to identify where populations are that are most vulnerable to extreme heat. This is kind of an important first steps that cities and regions take when tackling this issue. And we also hope to work with partners to share resources and suggest possible interventions that they may be able to implement or further explore in the most vulnerable areas in our community. And like I mentioned, there are a few related studies going on in the region, and so we definitely hope to contribute to and help inform those studies. And as far as the how goes, we have been analyzing relevant data, so local and census data, consulting with local experts, and working with our local partners. So we have a technical advisory group made up of local partners that's been reviewing and providing input on our work at every step. Next slide. There we go. So very early on in the process, we did as much background research as we could, which included, doing an extensive lit review on this topic, reviewing the federal guidance, looking at what other regions had done in terms of vulnerability indexing and mapping related to extreme heat, and then again also talked with a handful of local experts. And we were able to take all of this information and research and develop a framework for our analysis. Next slide. And the framework was really built around the fact that there are three determinants or three dimensions of extreme heat vulnerability. We know that especially in a region like ours, everyone can be impacted and is susceptible to extreme heat to some extent, but these impacts aren't evenly distributed. Certain communities are particularly affected based on their levels of exposure, and exposure can be impacted by temperature and weather, the built environment, the natural environment. They can also be particularly affected based on their ability to adapt or prepare for or cope with extreme heat. And then sensitivity to exposure is another component that plays into overall extreme heat vulnerability. So these are kind of health and physiological factors that may put people at greater risk. And so this framework provided us with an approach for kind of choosing indicators for our analysis. Next slide. And so to identify these indicators, we again relied on the background research we did, as well as the local subject matter experts we consulted with, who really provided some useful insight into local considerations or factors that might be a little more specific to our region. Next slide. And this is just a little more detail, so descriptions and sources for our indicators. Next slide. And so after we settled on these indicators, we were able to finalize our methodology, prepare and process all of the data, incorporate some weighting through a predictive model, and then perform our spatial analysis. And this is definitely oversimplifying things. I feel like I just yada over months of work, but the bulk of this analysis and heavy lifting really fell within these three buckets. And I do want to acknowledge Grant Schertz, who's on the modeling team in the MPO, for all the time and help he's been, especially when it came to the spatial analysis. But we do have detailed notes on each step we took. So, if you do have any technical questions following this presentation, feel free to reach out. Next slide. And so this is what the results of our spatial analysis look like. The extreme heat vulnerability map on the far right is a composite of the three previous maps, which again are exposure, sensitivity, and adaptive capacity. So those are the three dimensions or components that contribute to overall extreme heat vulnerability. Next slide. And so we're currently in the process of putting the finishing touches on an interactive web map that will allow users to dig into these results or findings a little more. We hope to have this ready to share with our TAG members within the next week. And after they've provided some feedback and input, we hope to make it more widely available. But as you can see on the left, right now it's displaying the composite score, so the overall extreme heat vulnerability layer. But we do also include the underlying components to give you a sense for what may potentially be driving a particularly vulnerable area. And I do want to reiterate here, since we're looking more closely at the results of our spatial analysis, that this is highlighting or showing you where populations most vulnerable to extreme heat are, and not necessarily where it's just the hottest. Next slide. We also started putting together some neighborhood profiles for some of the highest scoring or most vulnerable areas in the region. We've met with planners from most of the jurisdictions in the Valley to get their thoughts on areas they'd be interested in getting a little more information on. So we've identified areas in the cities of Las Vegas, Henderson, and North Las Vegas, as well as the unincorporated county, to examine a bit more closely. We chose areas that are all relatively high scoring, but that are also somewhat unique and differ from one another. And we hope that, they can potentially be used to look at broader issues in similar communities in our region. And so we plan for these to be fairly concise, maybe a page or two at most, and they'll be incorporated into our final reports. Next slide. So as far as next steps go, like I just mentioned, we are working toward finalizing our interactive web map and completing the neighborhood profiles. We're also going to be beginning the process of drafting our final report, and our third technical advisory group meeting is scheduled for April 1st. And at this meeting, we'll share some updates and prepare for some next steps and begin the conversation, or at least brainstorming around, if as we wrap this initial phase up, do we want to explore a potential phase 2 of this project? We've gotten positive response from partners we've shared this with thus far. There seems to be kind of a consensus that this data can help inform current and future planning and research. So we're definitely hopeful we can continue to build on this and maybe look at expanding the initial scope of this study. And with that, I'm happy to answer any questions.
Thank you, Mr. Govey. Are there any comments or questions from the subcommittee? I hear none. Then we can move on to the next item, Mr. Kellerman.
Thank you, Mr. Chairman. The next item on the agenda is item number 7, and it is to receive a presentation of the ongoing Opportunity Site Strategies 5-year progress reports. And this item will be presented by Ms. Michelle Laramie, Senior Regional Planner.
Thanks, Andrew. Again, Michelle Laramie for the record. And so as you know, we have been working to assess progress on each of the 4 Southern Nevada Strong Opportunity sites. So today I'm just going to be sharing a quick update on our work. Next slide, please. So since our last meeting, we have finished our report on the downtown North Las Vegas Opportunity site, and we've been moving forward with progress assessments on both the Boulder Highway and the Las Vegas Medical District sites. If you remember, for the Maryland Parkway site, we are waiting until the Maryland Parkway Transit-Oriented Study, which is currently underway, is closer to being completed before beginning our progress evaluation on this site. Next slide. So at our last meeting, I believe it was in November, we gave a presentation covering our work on the North Las Vegas Opportunity site. And that presentation, it detailed each of these components of the report shown here on the slide, but we didn't actually share the final report itself because we were still working through some final revisions with North Las Vegas. So we've now completed those edits, and we've included the final report in your backup materials for you. So between our last presentation and sharing the final report with you today, there really haven't been any changes to the overall content, but we did just want to make sure that you had a chance to look over and review the final report. The report is also available on our Southern Nevada Strong website, as well as the original implementation strategies that were adopted in 2015 for the downtown North Las Vegas site. If you remember that presentation, we shared that there are 4 primary sections of the report, and this report format is very similar for our current efforts with the City of Henderson and the City of Las Vegas, and it will likely start to look very familiar for you as we move forward with this work and continue to report on our progress. Next slide. So I've also covered our process for this project in the past, so I won't go into a lot of detail here, but I do just want to highlight where we are in the process now with our work on Boulder Highway and the medical district. So to date, we've completed the initial research and data gathering phase and have provided a draft of this research to each of our partners for review. And these drafts, they include an overview of the history and vision for each opportunity site, as well as our initial progress assessment of where the implementation strategies are at. So we have received some comments back on these drafts from our jurisdictional partners. So we'll be working through those revisions, and we'll also be providing some technical assistance and additional research as kind of a second phase or second part of this project as we work to advance the opportunity site goals forward. Next slide. So just real quickly, I do want to share a few quick details with you on our findings for each site thus far, starting with Boulder Highway. The Boulder Highway opportunity site is located at the Gibson-Broadbent intersection, and this site was chosen for its potential to become a thriving transit-oriented neighborhood center. And community input during the planning process, during the Southern Nevada Strong planning process, which contributed to this vision for the site, indicated that new development at the site should provide neighborhood serving destinations and amenities. It should improve pedestrian facilities and increasing housing options in the area. And it should also contribute to a neighborhood identity that includes developing the area as a gateway into the city of Henderson. Next slide. So there were 4 high-level actions that were created as part of the implementation strategies in order to encourage development that would contribute to this vision. And each action listed here does contain multiple strategies that could be pursued in order to achieve these goals. And so the majority of our work focused on evaluating the progress of these actions and strategies as they were adopted a little more than 5 years ago at the end of 2014. And so during that review process, we found that almost half of the strategies, 47%, are either complete or on track, showing that the city of Henderson really remains committed to achieving the opportunity site vision and the goals of the Southern Nevada Strong Regional Policy Plan. And much of the progress on these strategies are related to the actions demonstrating a public commitment to the site and improving transportation safety and connectivity for all transit modes. Next slide. A little more specifically, Henderson has completed many plans and policies that support the desired development types for the site. So in the 5 years since the implementation strategies were adopted, Henderson has been working hard to align their planning documents with the goals and values of the Southern Nevada Strong Regional Policy Plan, most notably adopting Henderson Strong in 2017. And recently, Henderson adopted the East Henderson Investment Strategy and are also currently undergoing an update to their development code, both of which further strengthens this alignment. Henderson is also already working to transform Boulder Highway into a multimodal thoroughfare, which will include center running transit, through traffic lanes and cyclist and pedestrian infrastructure along the entire length of their portion of Boulder Highway. But the site, it should be mentioned, is not without its challenges as well. So generally, we have seen region-wide that development types have been slow to evolve beyond the traditional auto-oriented types that are prevalent in Southern Nevada. And infill and high-density development, such as mixed-use and transit-oriented development, they just haven't been the preferred development type historically in the region. But we have seen some standalone examples of success here, such as some of the new mixed-use development near UNLV at the Maryland Parkway campus. And we also have many new and current studies like the Maryland Parkway Transit-Oriented Development Study, which are looking at new strategies for incentivizing denser mixed-use development in the region. We also know that aligning policies that encourage changes in the private sector, they do take time and patience, and Henderson has really laid significant groundwork for starting to see these goals realized. Next slide. So moving on to the Las Vegas Medical District, the vision for this area is to support the emergence of an urban academic medical district that is supportive of top educational and medical opportunities, as well as amenities that increase access to wellness, healthcare, and active lifestyles region-wide. Next slide. And strategies for achieving this vision, they included both primary as well as secondary actions. And again, each action has multiple strategies for achieving these goals. So here we see the primary actions, and they are focused on clarifying the goals and intent for public investment in the district, providing for coordination among various stakeholders in the district, and also providing some district placemaking and parking strategies. Next slide. The secondary actions support those primary goals, and they focus on increasing active transportation choices and open space in the district, and also encouraging supportive development like housing and retail in and around the district. And in the medical district, we found that an overwhelming number of the strategies, 90% of these primary and secondary strategies, are either complete or on track in the medical district. So it's really quite impressive the work the city of Las Vegas has been doing over there. Next slide. So it's no surprise then that many of the city's milestones have been reached in regards to the medical district's implementation strategies. Most notably, probably, is the opening of UNLV's School of Medicine and the recent groundbreaking on the medical education building, which really both help solidify the school's long-term commitment to the district and reduce some of the speculation that may occur in the area. Also, like Henderson, the city of Las Vegas has been working hard to align their plans and policies to be supportive of the type of redevelopment they'd like to see in the district. And this effort included the adoption of a form-based code in the medical district, which is a completely new zoning and development code for the region. Also, like the Boulder Highway site, there are still some challenges for encouraging redevelopment, such as the slow evolution of building types again in the region. And the form-based code is also new. And again, it will take time and patience to see how that works out and how it may change development trends in the district. Limited parking in the district and the prevalence of large surface parking lots also remains a challenge. And some of the strategies that were put forward for solving this issue, they may have been a little ahead of their time, and the city is still working through some of these strategies. And it also should be noted that COVID-19 has obviously been very challenging for various reasons region-wide, and it has had significant impacts for planning in the medical district as well in some unique ways. Understandably, the healthcare stakeholders in the district, they have had to redeploy their resources elsewhere due to the current public health crisis. And it's not totally clear yet how the crisis may also change healthcare in the future. For example, facility needs may change now that telehealth is emerging as a possible solution for addressing access to healthcare. So because of some of these unknowns, the strategic planning for the district is in somewhat of a holding pattern, while stakeholders are really just remain focused and committed to overcoming the current health crisis before evaluating what's next as far as planning goes for the district. Next slide. So I did mention earlier in the presentation that we have shared our first drafts of these progress assessments with each jurisdiction, and we're now coordinating the comments and revisions on these drafts. And also as part of the project, we have been conducting additional research around particular challenges that have occurred over the last 5 years for implementing these opportunity site strategies. So in the medical district, we will be doing a deeper dive into how public agencies have incentivized economic development in medical districts and similar innovation zones. And with the city of Henderson, we are meeting next month to discuss and develop some focus areas for additional research for the Boulder Highway site. So we'll be continuing to work on some of that additional research over the next few months. And we expect to finish these 2 reports in either the late spring or early summer, kind of depending on the timeline and availability of our partners as we move towards completing these projects. Next slide. So that concludes my report. I'm happy to answer any questions or hear any comments you might have.
Thank you, Ms. Laramie. Are there any questions from any members? I hear none, so we can move on to the next item, Mr. Kelman.
Thank you, Mr. Chairman. Andrew Kelman for the record. The next item is to receive regional staff updates. And so this is an opportunity for subcommittee members to share updates or information with other members.
Any member wants to share anything?
Mr. Chairman, this is Andrew Kelman again. The one update I would like to share is just if anyone was unaware that Craig Rayborn, who was the director of the MPO, is no longer with the RTC. Craig moved to Houston, and he's now the transportation planning director for the Houston MPO, which is called the Houston Galveston Area Council. And so with that staffing change, I will function as the RTC staff lead for this committee's organization and putting together agenda items every other month. So if anyone out there has any agenda items that they would like the RTC to present on at a future MPS subcommittee meeting, please just let me know and I can get that RTC agenda item added. Or if you or your agency has anything that they would like to share with the MPS, I can help get you on a future agenda as well. So that's just my update, so thank you.
Thank you, Mr. Kelman. Anybody else, any other member? I hear none, so we can move on to the next item, Mr. Kelman.
Thank you, Mr. Chairman. The last item on the agenda is your final citizens participation period.
So this is the second time set aside for public comment. Just a reminder that comments would be limited to the first 500 words, with the remaining words to be included in the written record. Do we have any comments?
Thank you, Mr. Chairman. Reagan Lively for the record. There are no public comments at this time. Mr. Chairman, that concludes the public comments for this item.
All right, thank you. If there are no additional comments, I will close this item. And if there is nothing else from any other member, then this meeting is adjourned. Thank you, everybody.